CVD, or cardiovascular disease, remains the #1 killer of both men and women worldwide. New research, though, is just coming out that shows there are new options to combat the risk. And here to break it down is Dr. Deepak Bhatt from Brigham and Women's Hospital. It's great having you, sir. How are you?
I'm terrific. How are you?
Doing very well. Let's talk about these statistics. They're pretty troubling. Every 38 seconds, somebody dies in the U.S. from CVD. Break down this Reduce It study you were a part of and the results that came of it.
Absolutely. In Reduce It, we studied 8,000 patients from around the world and followed them for 5 years. These were people with elevated triglyceride levels, that's a type of fat floating around in the blood, and additionally had risk factors for cardiovascular disease. We randomly assigned them to a drug, icosapent ethyl, or to a placebo. And what we found was that the drug, icosapent ethyl, reduced the risk of cardiovascular events by 25%, including a 20% reduction in dying from cardiovascular causes, a 31% reduction in heart attacks, and a 28% reduction in strokes.
That's pretty remarkable. So this is pretty groundbreaking news to come from this study.
It is. I think we're at the dawn of a new era in cardiovascular prevention, really akin to what the case was with statins a couple of decades ago. Statins being the widely used drugs for LDL or bad cholesterol. And here we're talking not about cholesterol elevation. The patients in our study were all on statins for the most part. What we're talking about is patients with elevated triglyceride levels.
Absolutely. So there's a new treatment that can actually cut cardiovascular related risk by 25%. Explain what it is and how it does it.
Sure. What the drug is icosapent ethyl. So it is a highly purified eicosapentaenoic acid, or EPA, which is an omega-3 fatty acid. Now, it's important that I point out that this is a prescription drug. It's a highly purified version of an omega-3 fatty acid. You need a prescription to get it. You can't buy it over the counter.
So the study for people with cardiovascular disease, this is a pretty groundbreaking, and we're on the path to something great here.
I think so. I think looking back in time, this will be viewed as a major advance in cardiovascular medicine, probably one of the major trials, clinical trials of this decade. And it, I think, applies pretty broadly to people who have cardiovascular disease, or even those who are at high risk of it, such as patients with diabetes and additional cardiovascular risk factors. Those are the sort of patients we enrolled who additionally had elevated triglyceride levels. So that type of person, which isn't uncommon in a cardiovascular practice or a primary care practice, seemed to benefit from this drug.
I'm curious, cardiovascular disease, rather, why is it such a big problem here in the United States? And are the numbers going up or down?
It's a great question. The numbers should be going down, but cardiovascular disease remains the leading killer in the United States and in most parts of the world. And even though we've made a lot of progress in the U.S. when it comes to things like smoking, with some cities adopting smoking bans and rates going down, on the flip side, other things like vaping are pretty popular among young folks. And yes, we made progress in treating bad cholesterol with statin drugs, but now we're learning from this study that high triglycerides, another type of fat in the blood, are also a risk factor for heart disease. And really fueling the cardiovascular epidemic in this country in particular, though this is true in other parts of the world, are high rates of obesity, which in turn triggers diabetes, and either obesity or diabetes or both really fuels cardiovascular disease.
No question. Dr. Bhatt, it's great having you. Thank you so much for this information. We appreciate it.
Thank you.
All right, if you want to learn more about the Reduce It study and how VASCEPA can help you and reduce your cardiovascular risk, you can visit the website you see on your screen. Amarin, a proud sponsor of the Morning Blind.